Great. Perfect. Okay. And now we're going to move on to some of the areas where we're seeing volume loss. And we've used fillers in the past, but when I talk with patients, I'm going to tilt your head a little this way. Everybody seems to maintain nice volume, particularly around the eyes, but we all lose volume laterally. So we can see for her, there's a little bit of a triangle area here, and especially along the arch of her cheekbone as well as her jawline, that's missing a little volume, so that if we add a little bit of volume in through here, that will help pick that area up. And for her, for today, there are many different fillers to choose from. One of the newest and what's become one of a favorite in our practice is RHA 4. RHA 4 is a very thick filler, so it's great for adding volume with small quantities of filler. And it's different from Juvederm and Restylane in its cross-linking. It's a little more naturally cross-linked, so it's very similar to the hyaluronic acid that's in our own bodies. And so it's much less likely to cause irritation, sensitivities, nodules, that sort of thing that we can rarely see with some of the other fillers. I'm gonna touch this way. Okay, so we've marked out the areas that we're going to treat to help give a little lift in through here. And then we'll move down and put a little bit of a thinner filler through the lip border, like RHA 2, which is a wonderful filler for fine lines, and it's also great for outlining the lip border. RHA 2 versus 4 just means it's thinner. So it's very smooth and it can go a little more superficially, and it won't show up with, if everybody's heard of a Tyndall effect or that little light blue that we can sometimes see beneath the skin, we won't see that with this filler. Okay, so I'll tilt you this way, and I like to use a cannula, so I make a little pinprick. And then the filler has a long blunt cannula on it, so it's not sharp, so it's much more comfortable for the patient, and it's actually safer. And so we see the edge of the cannula is here, right where we need the little bit of volume. You doing okay? Mm-hmm. And you can see how it gave a nice little lift to the cheekbone. I like to massage it into place so that it stays nice and smooth. Let me take a peek at you side by side. And already we can see a nice little lift to her cheekbone where we have the volume loss here. So we're getting there. A tiny bit more, right? We need one more floor. Perfect. And I usually put a little RHA on just to help prevent bruising, but you can see with the cannula there's really very little bleeding anyway. So generally it does not bruise. You can see how that lifts the entire side, gives a little more projection to the cheekbone arch, and even helps to sharpen up the jawline a little bit. Looking good. We'll go on to our next side. And let me see side by side. Perfect. And it's a nice soft filler, and one of the things it's known for is being flexible. And since something's flexible, a flexible filler is very good in areas of motion. So that's why I really love it around the lip borders where we're in constant motion.